pelvic pain is a common issue that many women face. The evaluation of pelvic pain also needs to be done in a formal way. There could be many reasons for the cause of pain, and many women come in and say that, my ovaries are bothering me. Now, the first thing that I think of is, okay, let me get to the underlying reason of why the pain is happening. If it's an acute event, if it's just starting over the last couple of days or for a week, then we need to see what the reason is that the pain is happening. So in the pelvic region, the way I try to categorize it for myself is what is there and what can cause pain. So common things are common. So the bladder is the first area that we need to evaluate, because bladder infections in women is very common. So we need to make sure there's no urinary tract infection. The second source is intestinal. So we need to make sure that is there some underlying inflammatory process that's happening, or if it's some kind of irritation or infection or bloating or something else that's causing the source of pain. Our perception of pain comes from anytime our body organs are stretched, it can cause pain. So if someone is having intestinal gas, it can cause pain. Same with if you're getting uterine cramping, it can cause pain. So initially, as a gynecologist, I need to rule out everything else, then get to whether this is anything gynecological or not. So the easiest way to do this is, like we said, we can evaluate the bladder, you can do a urine sample, make sure there's no blood in the urine, there's no infection. The second thing is I can do an ultrasound. We can look at the uterus, we can look at the ovaries, make sure there's no masses and there's no cysts in the ovaries, there's no fibroids in the uterus, there's nothing else that can cause the pain. And then the third thing again is that if, depending on the age of the woman, sometimes you could have intestinal issues, let's say like diverticulosis, which is little outpouchings of the colon that can sometimes cause pain. And then the fourth source is musculoskeletal. So if we ruled out there's no bladder source and there's no uterine or ovarian source, and doesn't seem to be any intestinal issues, then is there some kind of a hip issue or a muscular issue that's causing the pain, or nerve-related pain that's causing it? Now the fifth source would be some other things that are not necessarily easily diagnosed, but it's more of a clinical diagnosis just based on history. Things like endometriosis. There's another bladder issue called interstitial cystitis. Those are all things that have to be, you exclude the main things, and then when you get to that, then if you can't find a source, then you need to evaluate that. We'll be talking about endometriosis in a separate video, but endometriosis in itself tends to cause painful periods, painful intercourse, pain throughout the month. So that's one of those things that needs to be surgically diagnosed if you were fully going after it. But it is also a common source of pelvic pain. So the main point with diagnosing pelvic pain is whether this is something acute or chronic, and where the source is coming from to treat it appropriately.